So welcome everyone to this meeting, COVID Pay and the Bill. It's hosted by NHS Staff Voices, which is part of Keep Our NHS Public, a now even more important campaign against privatisation and the commercialisation of the NHS that has been so viciously ramped up over this past year. It's been quite a year, and I think we have reached quite a critical point, particularly with regards to the NHS. The government opening up over COVID, which I think many of us would agree is premature once again, has and will continue to put a massive strain on the NHS. Wards are quickly being sacrificed and becoming COVID wards, and there is a lot of stress within these wards at the moment. Secondly, the pushing through of this horrendous health and care bill, which will certainly have more dire effects. The impact will be on the NHS, on workers, on the public. And you may have also heard about this abysmal 3% pay rise that we've been offered. And what you might not have heard is that it will be coming from existing budgets, and that is definitely not a good thing at the NHS, as we have already been so critically underfunded. On a slightly more positive note, there is a real energy in the NHS, which is beginning to appear to be quite a ferocious resistance. We've got a couple of demonstrations that hopefully you'll hear more about this evening. So if you do know more about it, please get involved. At the end of the sort of session where we're going to hear from some of the speakers, we are going to open the floor. But the two demonstrations are to set the tone for the pay campaign as it goes forward. There will be a march from the UCH hospital at 4 o'clock, and St Tommy's will be marching from 5, meeting at Downing Street and really continuing to really show why it's so important for workers in the NHS to be paid properly. And this 3% is just not nearly enough. We need a restorative pay rise, and 15% is approaching that. So yeah, as I said, on a slightly more positive note, we will be hearing about some campaigns that should hopefully make us feel a little bit more optimistic, hopefully, about this fight. We'll be hearing from John Lister, who is the editor of Campaigns Together, The Lowdown. It's an online newsletter that you can find very easily, but we'll put a link in as well into the chat. We'll be hearing from John McDonnell. We'll be hearing from Matthew Dore-Weeks, who is a Unite the Union organiser, and we'll be hearing from a couple of NHS Staff Voices nurses, actually, who are going to be talking about how it is on the wards at the moment. Stacey Richardson and Karen McDougall. Unfortunately, we haven't got Holly Turner this evening. She couldn't make it, as she's on the ward and it's just very, very busy. So it's all really live tonight. It's all going on and we're dealing with it even on this meeting, I suppose. I'm going to start by asking a couple of questions to John Lister, who's going to be talking about the bill. John, can you tell us about the bill, really, the main points? What is this health and care bill all about? John, you're going to have to unmute yourself. I'm so sorry.
That's true. Yeah, there's a lot of different elements of the bill, and I think if we're going to build a campaign that's going to really reach the public, we need to find ways of distilling out the most accessible points, the things that people really can grab hold of and see the significance. And I think one of the things that affects every area, everybody potentially, is the fact that this bill gives less local voice and less local control in the NHS than any time since 1974. It basically reduces the NHS in England down to 42 decision-making bodies into so-called integrated care systems. Now, these bodies will cover areas ranging from about 1 million population up to 3.2 million. The northern one covers coast to coast in the north, 3.2 million people coast to coast of the north of the country. And it's absolutely massive, and a huge number of different localities and areas which will have no local voice to actually express themselves. And there's been a lot of talk from the government about the fact there will be so-called place level discussions and decisions. But actually the bill makes no reference to any such arrangements at all. And it's clear that all the decisions will be taken by the board. Now the boards will be chaired by someone who's appointed by NHS England, approved by Sajid Javid as Secretary of State, and you can't remove them. Once they're in place, they have extensive powers, but they will be locked into place unless Sajid Javid agrees they should be removed. So then they can appoint the chief executive of the system. They can also appoint the board members. There's no restriction on the number of board members they can appoint, and the wording is very vague as to who they can appoint. So it could include representatives of private companies. The GP representative could be from a private company delivering GP services like Virgin or Centene. And on top of that, the subcommittees and the committees that would be taking decisions and the partnership boards, there's no restriction at all who can be brought onto them. So again, there's the potential for the private sector to get a disproportionate voice in decision-making on a range of different issues. So that's the first thing. And of course, that means also Sajid Javid as Secretary of State, it gains 138 new powers under this piece of legislation to intervene any level he wants to, whether telling NHS England what to do, the integrated care systems what to do, and intervening either to block, to alter, or to demand changes in services at local level. So this is an extreme extension of powers, which actually leave local people with little or no voice. And there's just been, in the Health Service Journal today, there's a piece on the situation in Cheshire and Merseyside, where 9 councils have got together and laid down a series of basic demands as to what they'd want in guarantees that they'll be taken seriously in order to participate in these. Which is supposed to, the ICS is supposed to involve local government. And so one of them is, no changes, no loss of access to local services. And the NHS manager's response to this is it's confrontational and not helpful. Well, you've got to say, well, if that's confrontational, what are they intending? What kind of level of cuts and closures are they expecting to drive through, with the local government dragged in to kind of give some kind of plausibility to it, and so forth. So I think that we have real reason to be concerned here, because a lot of areas we've got very controversial plans for hospital closures, reorganisations. We've got a limited cash funding for each of these ICSs, and they're going to be required to stick to those cash limits. And we've already seen in a number of areas they've tried to do that by striking off services that are no longer going to be covered by the NHS, excluding drugs and treatments that you can't get anymore, and so forth. So the fact that there'll be no local voice to complain about this actually happening, no proper scrutiny of those decisions, the chairs will not be accountable downwards at all to any local areas, is extremely concerning. Now, on top of that, Sajid Javid's powers include powers to alter the professional regulation of various professions within the NHS, which obviously opens up the possibility of diluting skill mixes, bringing in less qualified staff to actually do jobs, removing some services from professional regulation altogether, and again the whole question there of what the implications are for staff. ICSs, as I say, covering in many cases very large areas and more than one trust, can potentially look to ways of requiring staff to work across between different employers. Although they've signed on to work for one, they could be required potentially to work across these trusts. We're getting collaborations formed of very large lineups of major acute trusts which are collaborating together as provider collaboratives. Now, one of those things might be linking up to actually try to put pressure on staff to cover for vacancies in adjacent trusts within the integrated care system. So those are worries as well. And just finally, I mean, the promise, the so-called good thing about this is it's supposed to be stripping away the Andrew Lansley's 2012 competition requirements from the 2012 Act. And it does actually abolish Section 75 of the 2012 Act, which requires services, clinical services, to be put out to competitive tender. The reality is only 2% or less of current services are put out to competitive tender anyway. Most of these services are awarded in other ways already, and much of the legislation has already been widely ignored or bypassed in the last 7 or 8 years. So the reality is there's no end to privatisation in this bill. There's no restriction on privatisation and outsourcing. There's no requirement that existing contracts be brought back in-house. But instead what there is the removal of the requirement to put them out in a competitive way. And we have what we've already got in the NHS, which is framework contracts, where you get pre-existing lists of approved contractors who can just be awarded contracts without competition. And of course, we had the dreaded prospect of extensions of the crony contracting that we had during the COVID pandemic, of huge contracts being awarded to ministers, mates, and Tory party donors without any competition or proper advertisement at all. So I don't think that the stripping away of the Lansley bill actually represents much of a gain in itself, and obviously the bill as a whole threatens a whole series of existing rights and opportunities for a defence of the NHS. So, but I do think the plus side is lots of Tories are clearly worried about it. Lots of three Tories actually voted against it with hardly any pre-campaign on the second reading. And I think that Tories are beginning to realise that actually what it also means is if the government's got all these powers to intervene, the government's increasingly going to be held responsible for everything that goes wrong in the NHS. And they don't necessarily want to be giving Sajid Javid, or indeed they didn't want to give Matt Hancock those powers. And so there's possibilities, I think, for a campaign that can actually speak in normal terms and build a broad popular concern about this bill, to actually challenge it and at least press for amendments that can, reduce the damage that it can do.
John, thank you. So, I guess the point that you're really driving home there is the fact that they won't be compulsory anymore for these kind of competitive this competition really, and any one MP or any one private company can just swoop in and make a real mess of the NHS actually, and take a lot of money out of the NHS. My question to you is, what is the impact that this bill is going to potentially have on workers, on the staff in the NHS, and of course the public as well?
Well, potentially the ICSs can look to, in each area, to look to, as has been done in previous times, attempts to actually undermine the national terms and conditions of staff, undermine the agenda for change, protection of basic terms and conditions, and national pay levels. Now, local pay is not always something that managers actually want to do, but these are desperate times, because this legislation comes with no extra money. There's no extra money. There's no extra staff coming out of this. There's nothing that's actually going to treat any extra patients. But we're in a situation where the Tories are looking to a new austerity period to actually recoup the money that they spent on the COVID pandemic. And certainly the NHS is facing a really tough squeeze. We're already looking at a situation where, in order to just attempt to reduce the waiting times, NHS England is looking to spend £10 billion over 4 years on private hospital facilities to actually treat NHS patients. Now, that, in my recollection, is the biggest single privatisation the NHS has faced since the privatisation of elderly care, with the so-called community care reforms back in 1993. So I think this is really significant, and clearly staff can face the requirement to go and work in private hospitals to actually deliver NHS services in private hospitals, where again, it could be a long distance from where they live, could be inconvenient for them to get to, and so forth. So these things will have an impact on staff, as well as the potential threats to terms and conditions that I've referred to before, and professional regulation.
Exactly, professional regulation. I mean, I think that's really quite a worry for staff who are already having to do much more work than they can actually, given that there is just never enough staff. So I guess deregulation will mean that we will have staff who are not as well trained as they have been so far, and we're already really struggling, and that of course inevitably impacts our patients and the public. I'm going to move on now to ask a couple of questions to Matthew. Matthew, are you there?
I am here, yes, I'm here.
Matthew. So Matthew has been organising very successfully and working really hard on a few campaigns. Matthew, can you talk us through a couple of these campaigns, please?
Yes, first of all, thank you very much for inviting me onto this Zoom call. It's a pleasure to speak about it. I have been the organizer for the BARTS workers at the BARTS hospitals, working for Serco, a big private company that the BARTS Trust brought in to essentially run the ancillary services for the hospitals. And recently we had a big win. The workers, the catering staff, back of house catering staff at the Royal London Hospital went on strike over roster changes and harassment and bullying, and they won. We were in negotiations with Serco for months and months of no movement, and the workers took 1 week of strike action, and Serco completely capitulated and gave in to all the demands of the workers. And that was, I wouldn't say it was unique, but it was the first time really, at least that I'm aware of for quite a while, that we have beat Serco, Unite has anyway, in a strike situation in health. And so that was a big win. A fairly small group of workers. We're talking only about 30 to 35 catering staff, but that win shows 700 plus ancillary workers across the 5 BARTS hospitals that Serco can be beaten. And soon we will be balloting, the workers will be balloting for strike action over a 15% pay rise for their pay claim across the BARTS hospitals.
Okay, Matthew, if somebody wants to get involved and sort of support, is there anything that they can do, or is there any way that
Yes, absolutely. What I'll do is I'm going to put my name and my phone number, well, obviously you know my name, my phone number in the comments box of here, and they can join us for protests, sit-ins. I want to say, because John McDonnell's on the call and he was very supportive of our strike 3 years ago, a strike that we lost, but a very, it was a good campaign, and many things were won in that campaign. We really brought together, staff across the hospital. There was a really great feeling about that strike. There was things that were won, like breaks that Serco tried to take away from workers. Unfortunately, the pay claim that the workers struck won a strike over at that time was not successful. But we believe that this time we're doing things differently, and this time we have learned from our mistakes, and I believe this time we will win. I want to make clear that the 15% pay rise that we're asking for is the reason why it's 15% is, of course, Unite, Unison, and others are fighting for a 50% pay rise, as they should. But these workers, the ancillary workers at BARTS hospitals, are paid 15% less than their NHS counterparts who do the same job. And that's why they are fighting for equal pay to NHS workers that do the same job as them. So the trust that never privatized that contract, they would be paid 50% more. The terms and conditions would be a lot better. In terms of help, just on that point, we're going to be doing sit-ins tomorrow. In fact, we're going to be doing a sit-in at the BARTS hospital, St. Bart's Hospital. We did a sit-in at the Royal London Hospital last week. And of course, I trust the people on this call to not reveal that, because it's a surprise, of course. And so we do look for other activists that can support us in demonstrations, sit-ins, and in other ways.
Exactly, and it is all linked. All of these struggles are linked, even outside of the NHS. That's really quite harrowing to hear that even NHS staff as a whole deserve a pay rise, but the workers that you're talking about are getting an even lower kind of cut, which is really quite dreadful. Is there any other way that we can support? And last question really, is there any, how do you think this does all link up with all of these other campaigns within the NHS? Or
well, it's a very good question. Look, and we're all fighting for justice. We're all fighting for a 15% pay rise, and I believe that we all believe in stopping privatization of these services. The fact that Serco is making huge amounts of profit off of the workers who've gone in to work and risked their lives during COVID, literally brought back COVID to their families. And there have been deaths amongst workers, amongst their families, and the tremendous sacrifice they've made during this time. And they've made that for the good of the public, of course. And the fact that Serco profits off of this is disgusting. And I'm sure everyone on this call agrees with that. And we all want to stop that. And there have been 2 tremendous campaigns that I know of, many, maybe more, not Unite, other unions, the St. Mary's and Great Ormond Street, that have ended privatization, that brought the contracts in-house. And we at Unite plan to do the same, that Bart's Trust, and we support any campaign across the health sector that is fighting to do this as well.
Matt, and yes, please do get in touch with Matt if you would like to be involved with the sit-ins. Obviously, we can't say when they're going to be and we can't publicise that information. So please, you will need to get in touch with Matt. Or failing that, do get in touch with us at NHS Staff Voices. The email address is nhsstaffvoices.komp@gmail.com. Thanks so much, Matt. We'll now move on to Karen and Stacey, who are going to speak about what it's like on the wards, really. Karen, can I come to you for maybe a little kind of glimpse of what it's like at the moment and the pressure that people are under in the NHS?
Indeed. I have to say, as Alia and Stacey know, a little bit unprepared for this because we're both covering for Holly, who's obviously unable to make it. So unprepared. I'm actually wearing my pajamas, so please excuse me. A couple of weeks ago, I was invited by one of these organisations, 38 Degrees it may have been, to write an email to Boris Johnson, the Chancellor, and the Health Secretary about the pay rise. So I'm just going to read a little bit. I ended up writing 4 pages, which I don't think is quite what 38 Degrees intended, but there you go. So I essentially put that I'm a registered nurse. I've got 2 degrees. I have 11 patients in my care on every single shift. That's 11 poorly patients. I work in elderly care, so they are elderly, so they deteriorate very, very rapidly. And I earn less than £14 an hour. I have all that huge responsibility. I literally have people's lives in my hands. It's incredibly scary. I'll admit the first year was I cried, I think, on every single shift. Still occasionally cry on a shift. I am actually in the process of transitioning to a different trust and actually going to the other end of the age scale, but I'm not expecting it to be too much different. And on the wards at the moment, it's just complete and utter chaos is the only word I can use to describe it. The location of where we're based has a certain amount of impact on the particular stresses that we're under on my ward, but I know this kind of working environment is replicated up and down the country. You know, we have constant pressure for beds, so we're constantly discharging patients or trying to discharge patients before they're ready. We then have constant failed discharges. Even recently, we've had a couple, the discharges were cancelled at the point the ambulance arrived, or while the ambulance crew were waiting to transfer them home, because they were poorly and they weren't fit to go home. But because of the pressure on beds, you know, we're just forced to send them home. The last year, obviously because of COVID, we've not been able to have any input into where they're discharged to, so we can discharge them to a nursing home. The opposite side of the county, and I live in a very, very long county. So we can send them miles away from home and from their family, and we've got no say, families got no say, patients got no say. These are incredibly vulnerable people who have absolutely no input almost into their care. We don't have enough staff. Obviously, there's 100,000 vacancies, 40,000 of which are nurses. We still have vacancies for HCAs. And I have to say the healthcare assistants that I work with are absolutely amazing. And they deserve far, far, far more than the minimum wage that many of them are on. They are the eyes and ears and the backbone of the ward, because they spend far more time with the patients than I do. You know, if one of my patients is well behaved and is not particularly poorly, they'll only see me 3 times a day for drugs rounds. So my HCAs are seeing me for, for far longer. Just the absolute pressure, the chaos, the lack of PPE, being used as cannon fodder over the last year, inappropriate staffing levels. We just can't look after our patients safely. And I'm aware that I'm rambling a little bit, so I'll probably pass on to Stacey, who hopefully will be a little bit more organised than I am.
I don't think you're rambling, Karen. I think you've made some really excellent points, and I was actually going to ask you the question that feels kind of silly, actually. But why do you think it's important that we kind of fight for a 15% pay rise, and if so, then why? Well, I think you've made some points to that effect, but
absolutely. Like I say, the responsibility I have for less than £14 an hour. My healthcare assistant colleagues, who are far less than me, our cleaners, our caterers. Unfortunately, those are employed by one of our privatised colleagues, and I'm currently witnessing them being bullied by the contractor. So yeah, it's a professional. It's a highly skilled profession. No longer are we just dabbing Kenneth Williams' fevered brow, flirting with doctors, and consultants trying our suspender belts. That's gone. What we're doing now is equivalent to what doctors were doing many years ago, and what our healthcare assistants are doing now is equivalent to what nurses were doing years ago. Everything's stepped up, the responsibility has stepped up, but the pay hasn't. And obviously that's contributing to the poor recruitment, the shocking retention, the 9,000 people that the government announced, was it last week or the week before? I believe a huge number of that are actually people coming back. So it's not really retention. I'm diverting off there, sorry. No, it is really, really important. But the government should then turn around and say that our trusts have to pay for it from their own funds, and it's not going to, the pathetic 3% to start with, then it's not going to come. I mean, that's just pitting the NHS against the public, because the public are just going to be, you're lucky you've got a pay rise, you're lucky that you're doing this, you're lucky that you've still got a job, we've all had a difficult year, and you've been given a 3% pay rise. But A, it's a real terms cut, and B, it's not enough to get people to join and get people to stay. I mean, I've only been doing it 3 years, and I've nearly left 2 or 3 times.
And I think, if I can just jump in, I think, the idea that nurses are doing what doctors used to do, healthcare assistants are doing what nurses used to do, really speaks to this fear of deregulation. It's just going to make things far worse. On that respect, we're going to be doing a lot more than we are being paid for, and we've been seeing that for years. I don't like talking about this, but when I started out in the NHS, I was doing things that I really shouldn't have been doing. Let's be honest, you know, we do that all the time in the NHS because I was willing to do it, because I had a capacity to do it. I was, you know, vaguely capable of doing it. They just, you know, they just put all of that work onto us, and it's incredibly dangerous. Stacey, hello. Would you like to tell me how things are on your? I mean, I know I've heard some of it, and it just really, it's shocking. You know, tell us how things are on the ward.
So I'm the opposite end of Karen. I do paediatric nursing up in Newcastle. At the moment, actually, we're in an RSV crisis. So RSV is a respiratory virus, which is like a common cold to an adult, but it can kill babies because due to their underdeveloped respiratory system. Usually we'd see a rise in RSV in the winter, but because we've been locked down for so long and now people are kissing babies, handing babies around, we're seeing a massive surge now, but it's triple, quadruple sort of the surge we'd see in the winter anyway. So as you can imagine, we're quite unprepared. This doesn't seem to be reported by the media, but it is countrywide. There's also reports of this happening as far as Australia. So it's an epidemic we're in at the moment. I normally work in trauma and orthopedics and spinal surgery, and I've worked there for 6 years now. I've been a nurse for 8 years. My ward is cancelled all elective surgery again. We've got severely disabled children waiting for hip reconstructions. At home in pain, they're on diazepam, they're on morphine, they're on drugs that you wouldn't normally give children just because they're waiting, yet they're not seen as a priority, which I think is terrible. We're in full FFP3 masks, and I've just actually got a promotion as one of the ward sisters, but it's probably came at the worst time. It's a baptism of fire, definitely, because the staff are just totally broken and disheartened. I think the fact that there's no sort of media coverage about this, but it's very, very evident at the moment with cancelling everything in children's services. There was even talk about cancelling cancer pathways in certain areas, which is something unimaginable. We've got babies going to intensive care. It's not really I'm a surgical nurse. I'm not really a respiratory nurse, although I do have a little bit of experience. It's still a lot to ask of the staff. Everyone's broken. We're now we went over during the first lockdown to help adult ITU. Now adult ITU are flipping over and they're coming in to help us. All the nurses are complaining, the faces are breaking down, and this has only been a week. There wasn't training, there wasn't the appropriate training, everything's been done in a rush. There's a discrepancy with COVID and RSV. So we are seeing children with COVID, despite the whole idea that COVID doesn't affect children. Don't worry, send your kids to school, it'll be fine. It doesn't affect kids. Well, I've seen kids getting pus drained out the chest with 2 chest drains in. So it does affect kids. It absolutely 100% does.
It's horrendous, and we've just seen I've just seen a comment in the chat. It's the same with us healthcare support staff workers and admin staff being told to do the first stage medical triage and assessments for calls with no medical training because they are given a basic script, and use your judgment is used way too often. And it's not just about staff having to do things that they are not being paid for, not being trained properly for, but it's our patients, as Stacey is saying, it is our patients who are getting, treatment that they shouldn't be. In CAMS, in child and adolescent mental health services, we are seeing more and more children put on medication instead of getting treatment. And that is what happens, as Stacey has also said. Stacey, can you maybe speak to the pay demand and why that's so important, please?
I don't think any child should be left on a strong opiates at home. Are they not a priority because they can't speak? I mean, is that why? It's terrible. The staff are told we can't retain staff. People are just wanting to leave. I feel like they're just trying to drive into the ground even more. It's almost like this is planned, to be quite honest.
Oh, well, that's quite a horrible thought. And how do you feel about your promotion, if you don't mind me asking? I mean, how do you feel about it? It's obviously really nice to have your work recognised, and you're obviously doing a really, really good job. But how does that feel? I mean, when you say baptism of fire, it doesn't sound Doesn't sound like something to celebrate, I suppose.
Well, even the matrons agree it's a baptism of fire, but in the right. But I feel like this is not a new thing. Yes, there's this RSV COVID thing going on. It's been going on a while. It's going to continue to go on a while. But for the last 10 years, it's been a baptism of fire for everyone new to a job. It's not new. And we'll almost get used to it, which is actually really bad. It's not until something like this is like the icing on the cake for my team that actually people stop and think and go, wow, this is very, very wrong.
Yeah, I think that's an important point as well, Stacey. We do get used to it in the NHS. We get used to not having breaks. We get used to working way, above and beyond what we are kind of paid to do. We end up, really compromising the care that we offer our patients, and it's harrowing for workers. And I think
it is, and I think we act a lot on goodwill in the NHS, and I think, that I work with the most amazing people in the world. I work with the most amazing patients, and that's why I do it. And that's why I'm still here at the end of the day. Someone's got to look after them. But at the same time, we've still got to fight against what's wrong.
We've got to fight for this pay rise. We've got to fight for the NHS. It's really important that people get involved with the NHS Pay 15 campaign. Please do check it out. And please do support the protest on Friday. I'm going to move on now to John McDonnell. John.
Hi.
Hi. First question would be, do you support the Pay 15 campaign? Tell us if you do, and if you do, then please tell us why.
Yes, 100%. I do support, absolute support. And the reason is this, is that if you look back on what's happened over the last 11 years of austerity, John Lister will touch upon this in other meetings as well that we've been doing, is that on average since the Second World War, usually what happens is the NHS gets about 4% a year in additional funds to keep it growing and to match some of the demand, particularly aging population, but increasing population, to keep up with those demands. And part of that has always been as well to make sure that NHS staff actually get paid a wage upon a decent wage that they can live on, that they can bring their family up on, that they can get by on and have a decent quality of life. And what happened after 2010 is that for a number of years, the NHS didn't get the 4%. They got just over 1%. So naturally, what was happening is that cuts started occurring. And the cuts, part of the cuts were the burden upon staff wages. And we're now in a situation, the banking crash was 2008. We're now in a situation where some of our staff, NHS staff, are earning either the same as or less than what they were in 2008. They've had their wages are frozen in effect, and in reality with inflation, exactly as they've said, is actually they've had their wages cut. And in all our constituencies as MPs, we meet NHS workers who are struggling to survive, full stop. NHS workers who are living off universal credit to survive. NHS workers who can't afford, in my area, there's no way the average NHS worker could even get on the housing market, can't even get a roof over their heads. And, there have been those stories, and it's true, of NHS workers having to rely upon food banks. Now, that's just unacceptable. And there is rank hypocrisy, a number of the NHS workers I've been speaking to locally and elsewhere is, it's all well and good people clapping us during the pandemic, but actually that is hypocrisy. At the same time, they're expecting us to accept a pay cut. It's just unacceptable. And the whole point about the reason people get paid a decent wage is because we respect what they do. That's the link between wages and respect is absolutely key. But it's also about being able to recruit and retain people. Who's going to come into the NHS and not go for another job when their wages aren't sufficient to survive on? And I think actually the general public, most people recognise that. And I honestly do think there's absolute support, public support for people in the NHS getting the 15%. It's simply fairness, making up some of the ground that was lost over the last 11 years, but especially as people, you know, lives have been lost over this last 12 months of NHS workers trying to care for us and save us. And I think the general public know that. And what we've got to do is get that across to the government, that this needs to be resolved, and it needs to be resolved quickly as well, because it impacts upon morale. You know, people going to work, exactly as we've heard tonight, really sacrificing themselves, putting everything they possibly can. And a lot of NHS workers now, they've gone through a trauma. It's almost like post-traumatic stress disorder among some of them. It is impact upon people's mental health because of what they've witnessed, and what they've witnessed has at times been horrendous, really. You know, the number of young NHS workers who I've met, you know, they're the person sitting beside someone who has passed away, unfortunately, with no relatives present because of COVID, etc. That does impact upon people. So the least we can do is actually make sure they're paid properly and that they can have a decent quality of life. So that's why I back it. And I think that's why, if you go out there and talk to people, I think that's why people back it as well.
Yeah, and I think people are beginning to support the NHS, which is feeling a little bit more positive in that way. And I think, you know, this particular crisis has brought out the real disparities and the real dysfunctionality of privatisation, actually. And the government have just continued shamelessly. So, yeah, it really does. We do need to really support it. We hear a lot of the time, John, that it is not viable. A pay rise. So I want to ask you, you know, you served as Chancellor of the Exchequer. Can you tell us whether it is viable for the pay rise?
Let's just go through this. The King's Fund, which is a significant think tank in this field, has estimated that the cost of a 1% pay rise is between 340 million and 500 million pounds a year. It depends on who you include. If you include everyone, doctors, dentists, and all NHS workers, the estimate was around 500 million. It's an estimate. So that's 1%. So if we go for the 15% and get that, it's what that means, 7.5 billion basically. The issue for us, that sounds an awful lot of money, but remember the government at the moment is having to borrow about 400 billion. But in addition to that, if people want to look at the last budget that Rishi Sunak put forward, there were corporation tax cuts that range between anything between 27, 28 billion, could go up to 50 billion. So actually, in the context of government expenditure at the moment, one, it's feasible, but secondly, there was a really good piece of research that was done and published in January. It was commissioned by the unions, but it was done independently. And it looks at what happens to the money when you pay NHS workers a decent wage. What happens to that money? Well, look, it's interesting. 80% goes back to the government in forms of either taxation, via income tax, etc. But also, what do NHS workers do? They spend that money in the local economy. That generates even more wealth. And again, the government benefits from that as well. If you were going to do anything to stimulate the economy, now we're coming out of pandemic, to assist us in getting back onto an even keel with our economy, you would be giving people a pay rise. So it all stacks up. It stacks up. It's affordable. And in addition to that, actually, it will benefit the economy overall. It's sound economics to give this pay rise. And what we mustn't allow them to do is to frighten us. You know, they're borrowing large amounts of money. We've got to pay it back. Of course we are. But one way you pay it back is you grow the economy. And how do you grow the economy? You make sure you invest, but also you make sure people have a decent pay rise that they can then spend, stimulate the economy, and it becomes like a virtuous circle that you create as a result of that. And I think when you explain that to people, you cut through all this mystique that comes from the government about economics, where they're trying to blind us with, I think, a fear factor. What this will do is give a lot of people hope that we can come through this pandemic with an NHS which is able to recruit and retain staff, but at the same time, we can contribute to the wider economic aims as well.
Thank you, John. I've just noticed some comments from John Lister, and I'm just wondering if you'd like to come back in quickly, John, and just share them with the meeting.
Yeah, I was just making the point that increased pay is a key component of any serious workforce plan. When the NHS is totally lacking in a workforce plan, has failed over the past, goodness knows how long, to actually develop any kind of strategy as to how to staff and therefore deliver services. And meanwhile, the vacancy rates have gone up and up, and on top of that, then we've had Brexit and now Priti Patel's immigration laws, which make it more and more difficult and unattractive for people to come to this country to work, and for people who are currently here to stay here, who are feeling that they're not welcome, overseas staff. So we're getting a multiple, virtually a perfect storm here of incompetence together with just straightforward reactionary politics. And if you start from the fact, we've got to find a way of paying staff, well, we can't afford 171 billionaires. That's my theory. They pay virtually no tax, right? But we seem to be sacrificing the entire economy and all the public services to keep these 171 billionaires in the style they wish to become accustomed to. And I can't see why the priority is, as John was saying, cutting corporation tax, allowing the major corporations to escape paying virtually no tax, allowing the billionaires to go scot-free. Meanwhile, we don't pay nurses and we don't pay the frontline staff that actually keep the NHS running, the whole team of staff, not just nurses, that actually keep the NHS running, allow the nurses to do their job, allow the doctors to do their jobs, and all of the professionals and other staff as well who play a vital role. And all of them need a pay increase to keep them in post. Otherwise, there are plenty of other places they can go and work, even in these straitened times. And so I just think it's self-destructive in a brutal way, because it's really undermining the essence of the NHS. What is a patient without a member of staff to look after them? You're just a member of the public who's got nothing. And we have to have that starting point. And we've had the most cynical lie from ministers saying whether 3% can be afforded out of NHS budgets without requiring cuts. We've had the BBC health correspondent, I saw it on Twitter, just relaying, this is what they say. Well, of course it's what they say. They're lying through their teeth. They actually know absolutely for a fact that is not true. And that the BBC and the other correspondents allow them to do that without a challenge. So we've got to try to find a campaign way to actually reach some of these journalists and just put them on the spot on these questions and start to get the heat put back on. The government's ratings are slipping now. Boris Johnson's ratings are slipping now. We have to make this part of that unpicking of the standing of this government and pile the pressure on, because otherwise we're going to watch this bill go through, we're going to watch these other things done, and the NHS is going to fall apart before our very eyes. And I think it's possible to do that. I'm not one of these people who's cynical about the public. I think the public do, if we can reach them with the right arguments, they will respond and they will support us in the main. And I think that's what we've got to turn to and build a campaign strong enough to start to pull these Tories apart and actually make it possible to defend our NHS.
Thanks, John. Some really, really good points there. I think what you've really reminded me is of the widening disparity that we've seen over this time. We've seen billionaires acquire more wealth than ever, record numbers of wealth, when we've seen at the same time hundreds of thousands of people being bluffed. And that really speaks volumes, I think. And also, I hate to admit that in the NHS we get calls all the time from private companies offering us all these perks and so much more money. And I think it's difficult for people to stay in the NHS when it's and so difficult to provide support in an institution that is crumbling, unfortunately. But as you said, John, I think people are really beginning to find the energy to support these campaigns, and that is really positive. We've heard from Matthew that there have been some really, really great things, and I think that is the important thing. I'm just going to remove somebody. I think we have a troll in our midst, so apologies for my attention kind of being all over the place. I do want to encourage people now to raise their hands and get involved, ask questions and make contributions, if that's okay. And that includes our panel. If you'd like to jump in, then just please do raise your hand. The way to do that is at the bottom of the screen. If you press the participants button. You should see your name come up on the right hand side. You might have to scroll to find your name. When you find your name, you can just hover over the blue tabs, and there should be a raise hand function. So just having a look if there's anybody who would like to speak now. I'm going to take, oh, there's somebody. I'm going to take Rhiannon Hodgson, please.
Hi. Yeah, I think in terms of my experience, I've been a mental health nurse for kind of 18 years and just not seen anything like what we've seen in the last kind of couple of years, really. Up until last June, I think I was working for crisis team, and the absolute amount of referrals that we were getting was unreal, you know, and we just increasingly getting referrals from our colleagues who were, you know, kind of working in ICU and on the wards. Absolutely, it was just completely unheard of, you know. And but the thing about it was that you know, our staffing's completely cut to the bone, so we were all doing two people's jobs essentially, you know, in terms of caseloads, and we were getting poorly because of, you know, the amount of work that we were trying to do that we just didn't have the staffing for. I've changed roles now, and I have a lot to do with CAM services, and I think you mentioned it earlier, the amount of children that we're having to turn away because, you know, they're only taking the most extreme end of things, and you've got children that are really quite poorly that are being left without services because we don't have the staff to provide the services, and that is just going to continue and continue. And, you know, children are going to, everybody is going to end up in an even worse state than we are now if we can't start recruiting staff. And on, you know, kind of in terms of morale, in terms of pay, in terms of the staff that we've got now, you know, nobody wants to come, and I completely get it, you know. And I love my job, but I am so ready to walk, and I've got so many other colleagues that are ready to throw the towel in because we just can't keep going at the capacity that we're going, you know, because we're getting poorly as well. But obviously, you know, this 15%, it wouldn't make everything magically better. Of course it wouldn't. But potentially we're looking at, you know, at least we might be getting a little bit more respect. You know, that's what it shows us to get that pay rise. It's not about money. It's not about any of that stuff, because like I say, you know, we're not going to buy a boat with it, but it'll at least show that we're being heard and we're being listened to. And I think, you know, we really need to do what we need to do to save this NHS, because, you know, people are going, oh, well, you can't do industrial action, you can't strike, you put patients at risk. We're putting patients at risk anyway, because, you know, people like the lady that was speaking earlier, I'm so sorry, I've forgotten your name. You know, the understaffing is putting patients at risk anyway. So, you know, if we don't do this, then there's no hope for us, really. And, you know, we've got to fight for this NHS, otherwise it will be gone.
Yes, thank you so much, Rhiannon. I didn't want to cut in, and I forgot to say as well, if we can try and keep our contributions to two minutes.
Sorry.
No, I think, you know, it was really valuable to hear from you, and it is just such a difficult situation on the wards and off the wards, really. It's not just about hospitals in the NHS, it extends to so much community care, as we know, and of course social care, and it's been a really difficult time. So given that we are sort of coming nearer to the second, or to the end of the meeting, really, I am going to try and keep speakers to about 2 minutes now, if that's okay. So please forgive me if I cut you off. Richard Langworthy, please. And you will have to unmute yourselves.
Is John McDonnell still here? Because I wrote to him and my parents threw out his reply because they thought it was an automatic "I'm not going to do as you say" reply, as I've been getting from my local Conservative MP.
Okay, I mean,
shall we come back in?
Yeah.
Richard, drop me another line, email me, it'd be easier if you can, that'll be great. I've seen your issues on the chat about advertising. The only problem that we've got about purchasing advertising around the NHS campaigns is there's Ofcom rules that prevent us doing anything that they consider as political, but that doesn't prevent us doing stuff in terms of social media. But Richard, email me with you, and it might be safer me emailing you than sending any hard copy that might be thrown away.
Okay, thanks. Yeah. Thank you, Richard, for that. I'm going to move us on now to Olivia O'Sullivan, please. Olivia, you'll have to unmute yourself as well.
Thank you. I'm just plugging my iPad in. It's just about to run out of
I can come if you like. And next.
Yeah, just hang on 1 second. It's in now.
Okay.
Sorry. I'm speaking from the Save Lewisham Hospital campaign, and thank you to the nurses and everyone for their contributions today. Really important that we hear about what's really going on. I just wanted to ask John Lister. We know that the Labour Party is opposing the new bill, which has got so many threats within it, but I just wondered whether any unions have taken up the political challenge of the new health and care bill. That's all I wanted to say. Just a question, really.
Thank you, Olivia. I'll come back to the speakers at the end, if that's okay. John, is that all right if we come back to you at the end? I'm just going to take a couple more, and then maybe we can have a little bit of a summing up from our speakers, if they'd wish to. So I'm going to go to Hilary Cave next. Hilary, you will have to unmute yourself.
Thank you. I'm from the Chesterfield Save Our NHS group, which is connected to the Derbyshire network of NHS groups. And we've done our best over a long period to support the staff claim. What I was hoping, and I do thank all the NHS staff tonight who've spoken so movingly about the awful situation in which they work. What I was wondering was whether Keep Our NHS Public or any other body centrally might help us to campaign by providing some more written materials. We have held 2 or 3 leafleting sessions in the street in the period leading up to the NHS protest around the time of the anniversary. So I think there are probably lots of groups like us who could make very good use of some centrally produced material.
Thank you, Hilary. Yes, we'll come back to the speakers again at the end, but thank you for that question. David Finnegan, please.
Thanks, Alia. Beyond the concerns of the staff themselves, I appreciate that they're under a lot of pressure and they've worked really hard throughout the pandemic. But in Norfolk and Waveney, I live in Waveney, Lowestoft, the problem we have is that we have 2 of the 3 main hospitals that are due to be part of this ICS are crumbling. The James Paget Hospital in Galston and the Queen Elizabeth Hospital in Kings Lynn are falling down. Now, we've got enough pressures on the NHS as it is at the minute with COVID and other illnesses not being treated. If we've then got to go into a programme where these hospitals are being renovated or replaced, it's going to be a long, long time before we're going to get this situation sorted out. And I just think it's important to remember issues like that, as well as the staffing issues as well, with the greatest respect to all the staff. Thank you.
No, I strongly agree, and I think staff probably really agree with you as well. So thank you for that. Stephanie Clark, please.
Thank you. I have a question. How can we break through into the mainstream media? I just feel so frustrated and shocked at the lack of understanding. Why isn't there more engagement? Why isn't there some engagement with the campaigns? I mean, isn't it the case that NHS is of concern to everybody? Isn't it the case, nearly everybody, isn't it the case that the bill is going through Parliament over the next few months? Doesn't it matter? Why isn't the press, why isn't the broadcast media taking it, investigating and taking it up? Thank you.
Thank you so much. I did see another hand. Richard Billam, have you spoken? I don't think you have. Richard, I can't see everyone, so if you might need to unmute yourself. Okay. Oh.
You hear me now?
There we go.
So I'm on a boombox and it messes things up. I wanted to ask if there's anyone from Unison involved in this Zoom. I'm a retired member and I've been waiting for some time to get any response from my union about this, and their members are on the front line. So if anyone out there can talk, I'd love to hear.
Okay, thank you. Dale Barr, please. Dale, you'll need to unmute. It seems like Dale's mic is not working because I think he is unmuted, so we can try again in a moment. I'm just going to read out some of the comments because I think it's always important to stay positive if possible. And we've got one saying, just to give hope, my neighbour's 4-year-old once said, I love you, Daddy, and I love you, Mummy, and I love Arthur, and I love everybody. Oh, I thought it said but Boris Johnson. But if a 4-year-old can say that, then there has to be some hope for the future. I suppose it is quite sweet to be positive in that way. Dale, do you want to try again? Okay, still not working. I can see that, Marjorie, you've got your pen up, I think. Would you like to unmute?
Yes. All right, thank you. I'm from Slough Tradescat, so I'm also from the Save Every Hospital campaign. We took part in a stall in Slough in celebration of the NHS anniversary a few weeks ago, and we talked to the public. We also gave out people NHS public literature, and we got people to sign a letter to the local MP, who happens to be Tan Desi, who's very good. Didn't need a lot of persuading because he speaks in Parliament an awful lot on the NHS and other things. But it got people involved. And I think, bearing in mind what everyone is saying, and the points that John Lister's making, I think, where the general public doesn't know what's going on with the NHS. With our Headwood campaign, we found critically that people assumed that the NHS would always be there. They didn't appreciate, they didn't necessarily understand, they didn't follow like we did what was going on to the NHS. So I think we really need to be talking about all the things that are being mentioned tonight and have been mentioned for a very long time, pre the pandemic. I know it's far more serious now, particularly for key workers and people themselves. But I think we need to talk campaigning and really need to get on board and get people actively involved, because people will come out and clap. They are hugely enthusiastic about the healthcare that they get and the commitment and the energy and everything else that people are putting into it. But they then need to do something. They are busy in their lives. They all have huge problems, but they need to get busy. They need to be writing to their MPs. They need to be doing a lot more. So I'm thinking, a bit like Hilary was saying a little while ago, in terms of keep our NHS public, giving people literature, but very, very simple, bullet points. This is what is happening to NHS. This is what is happening to the staff. This is why the campaign for the 15% is undergoing now. But everything else that is happening. But simple, easy things to read, so you can explain it. It's really important that people on the stalls also know all of this as well, because sometimes people come along with enthusiasm, but you know they need the facts. So you get it over your points as quickly and as efficiently as you can, engage people, but give them something to do, because otherwise they wander off and go off into their own lives. So, you know, yes, the general public loves the NHS, but they will lose it unless we all work together. Thank you.
Thank you, Marjorie. Yeah, I mean, please do get involved with Keep Our NHS Public if you're not already. Please do get involved with Staff Voices, with the pay campaign, NHS Workers Say No. Please do get involved in any ways that you can. I'm going to now go back to the panel. I can see we've still got some hands and we have still got some time to come back. But I'm going to quickly just go to, because I know that John Lister, you had to leave, I think. So I just want to give John a chance to kind of come back on a couple of the points if he would like to.
Yes, please. Thanks, Alia, and thanks for the points. So a question was asked about the union response. We've got a meeting, Health Campaigns Together has managed to get a meeting. It's a difficult time to get meetings with the unions over the summer break period. But we've got a meeting lined up in the middle of next month, I think it is, to talk through strategy. I'm sure what the unions will want is both a combination of a simple version that we can get across to members to actually explain what the bill means to members, but in terms that can easily be understood and that can actually be stood up. I think it's also important. There are some versions of interpretations of the bill that are going up that, quite frankly, are exaggerated and lack credibility, and it becomes very difficult then. You know, if you exaggerate and you actually assume, give the impression that things are in the bill that actually aren't in the bill, that is just your interpretation, it gets very difficult to actually get and hold an audience. And in particular, I think if we're going to build a campaign that's going to be able to split some Tory backbenchers and get some amendments to the bill, then we need to find ways of making those arguments that don't involve a lot of ideological assumptions, a lot of shrill sort of slogans and so forth. We have to argue it on a very clear basis of how the MPs might feel that their position as MPs are affected, and actually get to them that way. I think we've got the starting point of that, because a lot of them are already worried about it, but we need to find ways of making sure that we don't close their ears to our arguments by the way we say things. So I think it's quite important to get the language right, and it's also important from that point of view to get across to the broad rank and file of the unions, not all of whom are activists and not all of whom follow these things. And we have to find ways of actually getting across to them how important it is. That's made more difficult by the media, which I referred to earlier, because obviously, again, the media also, if we present an over-exaggerated view of this to the media, and we make claims which we can't stand up in terms of what's actually in the bill, or we don't fully explain the points that we're making to the media, they stop listening and they stop taking us seriously, and all they have then is the other side of the argument that they use as the press releases and so on from NHS England. So I think it's really important that as we campaign, we actually do this in as measured a tone as we possibly can, while stressing the importance of it, because otherwise we will actually set ourselves back. And finally, just thanks to David Finnegan for mentioning this capital crisis in the NHS. The backlog maintenance bill of the NHS went up 38% in 2019 to £9 billion. And in the middle of that, as he's saying, the hospitals are literally falling down. Boris Johnson's local hospital in Hillingdon is one of the ones with the worst capital backlog in the country. And these hospitals are falling down. And many of the ones that are actually in the worst state are not on the list to be replaced on this the fake 40 list of the new hospitals that were promised, none of which are so far materialising. So it really is important. The NHS needs capital to prop up and rebuild the hospitals, but also to reopen the beds that were closed during COVID for infection control and so forth. We need that capacity back in the NHS, so that needs capital and revenue. So we need a real injection of cash, and the government has to find ways to fund it. And basically just go out and tax some rich people, for goodness sake. They go out and tax some people to get the money to pay for NHS that all of us need, and rich or poor. Let's go out and raise that money. Let's get that campaign going. I'm sure we can build that campaign over the summer, and then we've got the autumn period to fight this bill through the Commons and into the Lords and so forth. So I think we will be able to get the unions on our side, the Labour Party on our side, and hopefully we can build a broad campaign that can reach across party and actually make it an effective one to blunt the damage of this bill.
Thank you, John. Fighting spirit. That's brilliant. We are running short of time, but I think it's been so really important to hear from so many people today. So I'm keen to take everybody whose hand has been up. I can see also Susan Richardson. I can't see your hand up, but you have had your actual hand up for a while. So I'm going to ask you to speak next, please. And then I'm only going to be able to take the hands that are already up, and Ellen, I can see your hand was up as well. So I'm going to go to Susan next, and then I'm going to go to the few hands that are left, and then Ellen, and then I'm going to ask the speakers to sum up, if that's okay. So Susan, if you can unmute, please.
Yeah, can you hear me? Yeah, just very briefly, that 4-year-old did say, "I love everybody except Boris Johnson."
Thank you for confirming that, because
that's what I just needed to confirm it.
Thank you so much. Okay, so 4-year-olds have more sense than the government. That should tell you something.
Exactly. Yes.
What we're living in nowadays. Very almost. Yeah. I mean, it says it all, really. I'm going to ask Jennifer Budden, please, to speak.
Thank you. I'm a user. I'm not a staff member. I recently spent 5 hours in Derriford, our local hospital in Plymouth, in A&E. Staff were lovely, worked off their feet. This is actually quite short, apparently, because there has been 15-hour waits. We've got black alerts. I think what happens is that everyone in the public gets frightened about this, but they know how dedicated staff are and they assume it will all happen. What I really wanted to say is, please get the factual information out, not the over stuff, but factually what it is, and then we can all use our networks to say to local contacts, how will this affect us in Plymouth, Devon, or whatever? And I think also we need to remind people of what the NHS was set up to do, which was to provide proper health care, stop illnesses in everyone, regardless of their status or income. And that's being eroded, and people know that implicitly, but they're not actually, it's got lost. And the other problem, I think, with it is that the public don't understand that this is such an existential threat, because the NHS has always been there and they think that it always will be. And that's really where we can stir everybody up about it. Thank you.
Jennifer, and yeah, I think, you know, that does get lost, given there's so much going on at the moment and we're fighting for so many different things. It does get lost that this is the NHS and it should be free at the point of use for anyone, for everyone, and we're almost losing sight of that now, because there are so many other issues that we're having to fight tooth and nail for while working incredibly hard, and that's everybody inside and outside the NHS. So thank you for that. And as for all of these comments about getting some materials out that help people really understand what's happening, that is definitely something that we are hearing, and we will be thinking about that, most definitely taking it back to the others, you know, who kind of can maybe speak to that. I'm going to now ask Corrie Louise Lowry to speak, and then I think the last person we're going to take is Richard Banker, because we haven't heard from you either. So Corrie.
Hello. In fact, it was John McDonnell was one of the first people to alert me about 10 years ago. I can't remember how long ago, when he came to Liverpool, and Cynthia Gallery had arranged for him to come up. And I'd never heard of him. It was before, you know, Corbynism gave me hope. And he pointed out that the NHS was under threat. And I thought, it can't really be. We all love the NHS. Tories need the NHS unless they're part of the 1%. Or Labour supporters or Liberals need it. As a country, we love the NHS. But when I found, you know, unfortunately, everything he was hinting at has been proved right. And the more I thought about it and saw what was going on, I can join Defend Our NHS and things. I realised that actually it's part of a plan. And Simon Stevens, who's been in charge for years, well, not that long, he came from a health corporation that was American. Now, the reason none of my friends believe me is because the BBC, even The Guardian and other health outlet, other news outlets are not shouting out. But also, and I'm sorry, John, but the front bench of the Labour Party are not shouting out. I can't understand this because it is the one thing that would ensure, I mean, I know we're not meant to be political, and I can see the point of not being political, but actually we do need our politicians, regardless of parties, to shout out, because otherwise people don't believe us. What party would destroy the NHS? What politicians would allow it to happen? That is why we're not being believed. And it isn't just the BBC, it's every politician in this country. Apart from, I do exempt some, I really do, John. And, you know, quite a few, and I'm sure there are some Tories and Liberal who would defend the NHS, but I can't understand actually why the BBC and most politicians are letting it roll over them. I mean, it's not that difficult to understand.
Thank you, Corey. I'm going to have to stop you there, even though I agree with every single word that you're saying. Thank you so much. Dale has joined us again, so I am going to ask after Richard Banker to hear from Dale, but then we will go back to the speakers. Richard, please.
Okay, I'll try and keep it quick. I'm a retired civil servant and PCS member, and I've come across John McDonnell about 15 years ago in the House of Commons, so his support for the public service is well known to me and my union. I've also had experience of being an inpatient over the years and also involved with campaigning over the NHS. I think there's probably a perception that the NHS is under stress and short-staffed and everything like that, but the extent of what is going on now is not actually probably known to the public because it's in the interest in the government and the media to try and conceal it, regrettably. Yeah. I think John Lister made a very good point about the danger of exaggeration, and there is an automatic habit of really talking up the threats, and the trouble is if you say that, then people will just think we're doomed, there's nothing we can do about it. And there's been a short of a need to show that we can actually fight and actually get some. Once you start getting some small victories, then things become easier. I mean, I found also with getting materials is one thing, but actually getting boots on the ground and getting them to people is something else. Outside the local hospital, we're sort of confined to a space on the pavement because that's where they let us go. And a lot of staff going into work, they're in a hurry. You've got 2 seconds to get their attention to give them a leaflet. I mean, perhaps you ought to make it shorter and sharper. One thing worked really well, and that is that recently we had an NHS birthday event. We went to the vaccination centre, which is probably a bit of an outpost away from the hospital. And when you gave them the sort of, you know, we love you NHS and birthday cake to them, that really went down the treat. It wasn't just politely accepting a gift. They really, really did appreciate it. So we've got to think of perhaps some different ways of physically getting through. I'll leave it at that anyway. Thank you.
Thank you for that contribution and for keeping it short. Thank you so much. You know, there's so many comments in the chat, and I would love to really be able to speak to them and hear more. What I will suggest is, you know, if you've got something to say and you would like to have a chat, or you would like to kind of contribute in some way, then please do not hesitate to email us at NHS Staff Voices. I'll put the email address in the chat, and that will come straight through to us, and we can see if we can't kind of get some ideas together, really. Oh, that was it. Dale Barr, you've rejoined. Do you want to have your last try, Dale, before we go back to our panel, please?
Yeah, can you hear me now?
Yeah.
Yeah, just briefly, I know John's spoken on this in the past. There has to be now absolute transparency with politicians and their relationship to private health. There has to be, this now has to become a conflict of interest. John knows far better than any of us. Alan Milburn, who was the health secretary under New Labour, has a senior position at United Health, who are now, they're operating in this country under Optum. You can look at their record in the United States since 2000. The penalties against them, litigation and lawsuits, is now in excess of 600 million, and that's just since 2000. And the government are saying this firm's been brought in for efficiency. That is a complete myth. And just a very, very quick one. I know John's, this relates to John as well. There is a professor called Guy Standing who formulated a plan with John, because when people say, well, what would you do? Because some people get very sort of concerned about taxing the rich for some reason. There's I believe Guy Standing said, if you could re-nationalise all your water utilities, after running costs, overheads and everything like that, you could pay a dividend to every UK adult over the age of 18, £28. So you could take £1 and use that as a hypothecated tax to the NHS, and I think that really is probably around about 400 billion. So the solutions are there, and the arguments can be made. If you ever get a chance, read Guy Standing's Plunder of the Commons. It relates with the NHS. Very clever man. You'll never see him, very rarely see him on ITV or BBC, but he's on RT and occasionally on Channel 4. He's really good. But thanks very much. Glad to find you. Thank you, patience.
Thanks, Dale. Okay, so we're going to have to finish there from sort of the floor, and I'm going to ask our speakers if they'd like to come back. I'm going to go to John first. John McDonnell, please.
Just very, very quickly, this has been really interesting. Thanks for all the speakers. On the 2 points we've discussed, very briefly, on the issue of pay, let's get this absolutely clear. This is simply workers asking for a decent level of pay, and therefore 15% is perfectly reasonable, perfectly affordable, and the right direction if we're going to maintain the levels of staffing that, or achieve the level of staffing that we want. It does mean, though, and we have to be honest about this, it may well come with this government, because they have an 80-seat Tory majority, and because we have the Prime Minister that we have, it may well come to industrial action. If that is the case, we've got to support the NHS workers. It's as simple as that. Nobody wants to go on strike. I don't know a single NHS worker who'd want to go on strike or leave their patients or anything like that. But unless we back them on this, we'll be in a situation as we go on where we can't recruit, we can't retain, and we continue to exploit and really undermine, to be honest, the health of the very workers that are caring for us. So we have to support them in whatever action they decide is necessary. That's the first point. The second point, on John Lister's point on the issue of the legislation, is quite right. We've got to be extremely precise in how we examine the bill, how we analyse it, and how we communicate about it. But the key point he made is this, that this bill loses us democratic control of our NHS, and it will eventually, we've already seen the start of this on some of the groups already, it will enable the government to populate the decision-making structures with effectively representatives of private companies. That's the fear, and the threat therefore, as someone put in the chat, it's a threat by stealth. You erode it over years, so eventually you lose it. What we've got to do, and exactly as people have said, with simple leaflets, simple messages, as John Lister has said, is to get that threat across, because we can nip it in the bud if we mobilise effectively around this bill. And don't think that just because the Tories got an 80-seat majority that we cannot defeat them, because we can. A lot of those Tories are sitting on relatively small majorities. Some of them are in representing constituencies they never ever thought they'd ever represent. So there's a real vulnerability there, I think, that we can defeat them on this bill. And the final point I'll make, I just think we should be proud of our NHS. No, you know, I think it's one of the greatest gifts that was ever given to us by that Labour government after the Second World War. But it wasn't just given to us. It was given to actually inspire the rest of the world as well. And it's interesting how many countries now are looking to us and thinking that's the sort of service NHS that we want in our own countries. I think there's huge support out there in this community. And I think if we can mobilise that support, and I think we can, we've seen it from tonight's meeting, I think we can win on both the pay and also on maintaining democratic control of our NHS. Thanks, Alia, as well, for chairing it tonight. You've done brilliantly, to be honest. Thank you.
Well, thanks for everybody who has joined. And I do want to just ask Stacey and Karen if they would like to leave us with any last words. We've got 3 minutes. Please, anything that you'd like to add?
John just said it perfectly there. None of us want to strike. It absolutely fills me full of horror, the idea of striking. It's something that the NHS workers, it's just not us. But I think this is going to have to happen now.
Thank you,
and I think he said it beautifully. We should be bloody proud of it.
Yeah. Agreed. I went and got my little badge to just have by my side on the table. Karen, would you like to add anything?
Yeah, again, just to echo everything that John's just said, and Stacey, and many of the contributors from the floor as well. Yeah, on a personal level, you know, good pay rise. Yeah, obviously would like it. I would love my colleagues, particularly my healthcare assistant colleagues, to be valued for what they actually contribute. Also our cleaners and our caterers and porters, everybody, admin staff, discharge trackers, everybody that works for the NHS. But more than that, for me, this is, you know, it's a fight for the very existence of the NHS. You know, we are so close to losing it. And if we don't get this message across, then we are going to lose it. And once it's gone, it's never coming back.
Thank you, Karen. And yeah, it's true. I think the point that John made, that sort of reiterated about John Lister's point about the bill and the fact that it does remove democratic value and makes things far more dangerous for the NHS with regards to privatisation, which we've seen over this year has been an absolute disaster with track and trace. We've seen the power and the importance of kind of you know, empowering NHS workers and providing the NHS with the capacity to do incredible things that we are capable of doing. We really need to see that. So thanks everyone for joining today. Please do support all of the campaigns that have been mentioned. Get in touch with us if you'd like to. The email address is there. Like the NHS Staff Voices page on Facebook, follow us on Twitter, and we hope to see you again. Bye, everyone.